A pleasant good morning to you and welcome to Health Solutions Made Simple. I'm your host, Carlton Lando, registered pharmacist. This morning, we are going to focus on blood thinners and what you need to know about them, particularly for many of you who like natural herbal supplements. There are many herbal supplements that are on the market that also have blood thinning properties. You may be drinking these herbal supplements or taking them daily without even having that knowledge that they are thinning your blood even more whilst you are on this blood thinner. So basically, blood thinners work in two ways. You have antiplatelets that keep blood cells from sticking together to become a clot. And then you have the anticoagulant properties. By so doing, what they do, they cause clotting to occur much slower. So when you are prescribed a blood thinner, it means that there would have been preliminary tests that would have been done by your doctor to recognize that your blood is thickening too quickly. And that in itself can predispose you to clotting. And hence the reason why a blood thinner would be given to prevent a stroke, to prevent a heart attack. And as I said, there are many blood thinners that are available on prescriptions, and blood thinners are generally prescription medications. So you might be using warfarin. You may use Xarelto. You may use heparin, Plavex, aspirin. The Eliquis, and the list goes on of these blood thinners that are available on on prescription. However, there are many herbal supplements that are right in your kitchen. You may be taking them every day, whether it's through capsules, whether it's through teas, and you do not know that they may not be advisable for you to take together with these blood thinners that were prescribed, or this particular blood thinner that was prescribed to you. So let's look at some of the herbal supplements that also have blood thinning properties, in the sense that they do have that functionality that they can thin your blood. Um, Maybe not as um, effectively as that of some of the synthetic drugs, but if they are taken in high doses and if they are taken very frequently, they may have similar mechanical action. So, turmeric. So, you might be taking turmeric and may not know that it has blood thinning properties. So, turmeric, ginger, vitamin E, ginkgo biloba, aloe, evening primrose oil. You might be taking that for hot flashes or menopause as a female. Grapeseed extract. It comes in capsule, it comes in the liquid. Very good antioxidant, but it also have blood thinning properties. Cayenne pepper. You may not know that, but cayenne pepper is also a blood thinner. Garlic. And we know we use a lot of garlic in the Caribbean. We cook with garlic, we drink garlic tea to help to reduce our cholesterol, to help to reduce our blood pressure naturally. But it's also blood thinning. It also has blood thinning properties. Um, Melatonin. Yes, we use melatonin to sleep, but to our surprise, it also have blood thinning properties. And feverfew. That is a natural supplement that is available as well to help people to sleep. That too can also thin your blood. So whilst you are on these blood thinners that are prescribed to you, you want to be very, very much aware of some of these natural supplements that can also produce blood thinning properties. And while I'm on this, let me just remind you that once you are taking blood thinners, you want to be aware that these blood thinners can make your skin more sensitive. So you want to avoid long periods in the sun. You want to be very careful with your skin, and so forth. The other thing too that you want to be aware of with blood thinners is that they can thin your gums. So you are more likely to have bleeding gums, bruising of the gums, sensitivity of the gum. So if you are using blood thinners and you find that when you brush you bleed, that could actually be one of the complications of the blood thinner. What is generally recommended is if that occurs, you need to let your doctor know, particularly depending on the extent of the bleeding. And at the same time, too, it is recommended that you would use a soft toothbrush, a soft bristled toothbrush, rather than what we call a hard toothbrush or a foam toothbrush or a medium toothbrush. So you want to use preferably the soft toothbrush. All right, if you find that you're having bleeding. And of course, once you are going to see a doctor, you need to let them know if you are on any blood thinners before they prescribe any other medication to you, because there could be drug interactions with some of these blood thinners. If you're going to the dentist, especially if you're going to have cleaning or extraction, normally most dentists will make you fill a form, or they may ask you questions about medications that you are on. It is important, if you do not remember the names of the medication, that you write the names of the medications that you are taking, and you put that list in the bag that you generally would walk with if you're going to the doctor or to the health center. So I know some of the names are not easy to pronounce, but at least you have that list. Now that you have smartphones, you can write down the list and then take out a photo of that list and store it in your phone. So once you go to see a healthcare provider, you have that list with you that you can let them see the medications that you're taking. Because if you are on a blood thinner, depending on the dosage, it might be difficult for you to have an extraction and even for you to do an invasive surgery. So if the surgeon has to cut you, you may have to not be on the blood thinner for a period of time before the surgery is done. So I just wanted you to know these facts as it relates to blood thinners. So, as always, your health is indeed your greatest resource. Preserve it. Have a wonderful morning. And remember, this is brought to you by Health and Communication Solutions Limited, your number one health outlet in Dominica. Take care. Have a good morning.